Hello, I'm Nila Cobb with West Virginia University Extension, and I'm honored to get to share an overview of my work with West Virginia youth and families to help them thrive. I'm currently a specialist for health promotion and youth at risk, and I've always been involved in extension work, first as a child in rural West Virginia 4-H, and then as a 4-H volunteer, followed by my role as a county 4-H agent. It's been my experience that if we are truly going to level the field for inclusion for West Virginia families, we first must address the issues of poverty. In West Virginia, 78% of our youth are reported as needy, according to the State Office of Child Nutrition. These are three of the grant programs, along with others, that have served us well in extension to assist with getting dollars in place to ensure our youth have access to 4-H. Health Rocks is one such program. West Virginia is known as a tobacco state, where we have pandemic numbers of people who have died from smoking related causes. And it's always been my pleasure and passion to work with National 4-H Council over the years to not only provide this program, but to continue to innovate and refresh for successful implementation. This program not only addresses tobacco, but also how to live a healthy life substance-free. We cover things like mental wellness, carefully choosing friends, positive role models, decision-making, and currently we are reaching out to about 12,000 youth in West Virginia annually as a part of this program. The 4-H mentoring program is another grant through National 4-H Council, and it is funded through the Office of Juvenile Justice and Delinquency Prevention. West Virginia also took a leadership role in this program from the outset. We carefully positioned this program in a geographic region most impacted by the opioid epidemic, starting with Huntington, West Virginia. This program model remains one of the most successful opportunities to reach the truly underserved communities where I believe youth would not have access to 4-H programming otherwise. Strong partnerships have been built between community agencies, schools, and families that have existed for many years. And we have some very positive outcomes through the evaluation process. The CYFAR program, Children, Youth, and Families at Risk, is NEFA's funding to improve the quality and quantity of comprehensive community-based programs through extension. I had the pleasure of working on 3 different programs. Each program lasts 5 years, and they have very robust outcomes for limited resource families. The first project was focused on after school and actually resulted in building our statewide policies and partnerships for high quality after school opportunities for West Virginia youth. The second project was bringing evidence-based family skill training programs for high-risk families into communities of great need. Along with the school-based drug, alcohol, and violence prevention program, we had some really impressive outcomes as well. Finally, our current program, which we're just a little over a year into, is our partnership for the United We Can Youth Entrepreneurship Program. We're going to help teens gain real life skills, hands-on experience, while helping them discover their sparks. Like many people in our country, I have a story of sorrow about someone very close to me who struggles with substance use disorder. Through extension, I've been able to turn my experiences into work to help others. This mission includes goals of discovery of what extension's role is to assist others. I am the co-leader of the Resiliency and Recovery Task Force for WVU Extension. This is a high-functioning cross-unit task force, and it's made up of likewise interested folks, colleagues around this topic. One of the outcomes of this team was to collaborate with the College of Education and Human Services to create the TRAIN program. Now that's an acronym for Teacher Resources for Addiction Impact Now. This professional development program for teachers resulted from first a very broad survey of West Virginia teachers to discover their issues of working with youth and families impacted by addiction. It has been provided to 37 of West Virginia's 55 counties so far with excellent results, and has also led to a community and a teen module educating around issues of addiction. Recently, we were able to secure a rural health and safety education grant to continue and expand our work on this effort. As a health specialist, I am also engaged in many opportunities to highlight the health H for 4-H work. And one of my important roles is as a co-leader of the 4-H diversity, inclusion, and equity team. This has led to opportunities for me to expand my own knowledge and build skills as a facilitator for the Coming Together for Racial Understanding program. I frequently lead discussions of professional development around mental health resources, mindfulness, and the dangers of stigma. And the most recently, some of the most recent work around this area is advocating and providing leadership for workplace wellness. Many of us know in this room, networking and partnerships are the basis for all of Extension success. And as a part of that, I am the state liaison with the West Virginia Department of Child Nutrition. Through our abundant summer programming, because we have county and state camps, we have residential camping. We do a lot of that in West Virginia. We have day camps, as well as our summer reading and nutrition programs. We have a program called Energy Express that is very successful, a 6-week summer reading and nutrition program. So we're the largest collaborator with the federally funded summer foods program here in West Virginia. We're also very active in corporate sponsorships such as Aetna. We were able to receive a $50 per child for 4-H programming benefit through Aetna's Better Health Medicaid with their Medicaid program. And then finally, I'm happy to report that we have never had to turn a child away from any of our 4-H camps or activities due to the inability to pay. We have an extensive camp scholarship program that is made possible by private donors, local and state, national grants, and all of those things. That is what I like to believe is the most important work we do, which is getting those funds directly to the children that need them both for 4-H programs. Finally, I would just like to say thank you so much for this opportunity to share my work. And I truly thank you for this recognition, and want to thank you for taking a notice to serving under our underserved populations. So thank you very much.